Being a doctor, often I need to answer three most important questions on cancer. And we are going to discuss those three questions today. The first question is, many people ask me, what are the causes of cancer? The number two question that I face most often is, the cancer increasing in number? And the third question that I sometimes need to find answer to, that what is the point of living so much of disciplined life if there is any guarantee that if I lead a disciplined life that I will not have cancer? So let's dive into all those answers of these questions. The answer is not easy. And certainly I cannot give you this answer in just single line. It is very complex. However, one important trend or one important answer we must consider, that the cancer is mostly caused by genetics and environmental causes. And there is a theory which is known as multi-hit theory. And this is a common theory within the oncologists, that means cancer specialists. That means a cell does not turn into a cancer unless and until that cell is hit by multiple numbers of causes which causes cancer. Causes of cancer can be broadly divided into genetic causes and environmental causes. And often these two factors interplay and cause cancer at the end. Sometimes people feel very helpless that if I am born with some genetic defect, by the way, most of us have got genetic defects. If we are born with some genetic defects, so it is almost inevitable that I will have cancer, won't it? But then what's the point of then treating cancer and being aware of it? Now, here comes the crucial factor. There is a theory which is known as nature and nurture. The nature means that the genetic makeup with which we are born with, and nurture means how we nurture those genetic makeups. That means I may have some tendency to develop cancer, but with that, if I keep on having laziness and sedentary lifestyle, not having exercises, love the sweets and fatty foods, then definitely who can prevent me from developing cancer? But again, if someone has got tendency to develop cancer, if they lead a more healthy and disciplined life, they can reduce their chances of developing cancer. Often, we overestimate the genetic factors as cause of cancer. However, we must emphasize the more important environmental factors. What could be the environmental causes of cancer? They are innumerable. There are a lot of stories, lot of lists and everything. We are going to talk about 2 or 3 important points. So let's discuss about the infection which causes cancer. We all know the HPV causes cervical cancer, which causes a lot of throat cancer, it causes a lot of potty passage cancers. However, there are vaccines available for this HPV. There are effective strategies to overcome the effects of HPV. However, if you live in a country like India, where still now the HPV vaccine is not given by government, and it is your choice. So you can imagine that having HPV related cancers will be higher in India. Whereas in Western countries where the HPV vaccines are very readily available and it is given by government driven mechanisms, HPV cancers over there are reducing in number. So mere fact of living a special country can increase the chances of cancer of certain varieties. The opposite is true for breast cancers. In Western world, the breast cancers are happening more. In India, it's not that, though Indian numbers are catching up. Again, another cancer, that is uterine cancers. So these cancers are happening more and more in Western countries. In India, it's not that common. Why is that? Because in some countries, people are more sedentary. The obesity is an epidemic nowadays, and it is affecting many of us today. Apart from that, we must not forget the story of Japan. In Japan, after Second World War, there was a change in their food habit which causes a lot of nitrate accumulation in the food, as well as taking food with high salt content. Therefore, in Japan, the stomach cancer started to rise significantly. So when Japanese people found this out and Japanese government found this out, they changed their lifestyle. They changed their environment, and nowadays the Japanese stomach cancer rates are not that high anymore. Of course, we are using a lot of hormones to produce milks and dairy industry. We are using rampant chemical fertilizers in vegetables and stuff. So these, when comes to us directly or via water and everything, it causes cancer. So these are the important environmental factors. The second question where I need to find answer to is, the number of cancer increasing? Of course, there are complex formulae behind it. We'll not be able to give you the full story, but apparently, yes, the cancers are rising. But we also have to understand the reporting of the cancer is also rising. People are becoming more aware. People are reporting cancer more and more. So therefore, we are seeing more and more cancer. Let me give you a small example. Previously, if your distant relatives would have cancer, then you would probably not know. But nowadays, with the advent of newer technologies, communication, WhatsApp, Facebook, and everything, you get to know that that person had got cancer. Suppose in 1930s, you would not know that your distant uncle had cancer, but today you will get to know. So your perception will tell you that yes, cancers are increasing in number. There is another important concept which is known as cancer registry. Cancer registry is a record where a country's cancers are recorded. Now, previously, for an example, in India, the cancer registry were maintained in big hospitals, big cancer hospitals, and that too only in bigger cities. But nowadays, because of the government and more aware people, the cancer registry is now reaching the villages. So it is recording all the cancers of the villages as well. And it is coming to us. So the perception is the cancers are increasing in number. But whether they are truly increasing in number, that will remain a debate for many more years to come. We are using a lot of estrogen injections in the dairy industry, and we are using a lot of chemical fertilizers, that unapproved chemical fertilizers for the vegetables and stuff, and these are also of course adding up to the cancer numbers. There are no doubts about it. The number 3 question, that is there any point in living disciplined life? There is definitely a nuisance value if we do not live disciplined life. In my childhood, or at least in my mind, there was a question that what's the point of studying so much? Is there any benefit? That will I get a job? Is my job guaranteed? Will I have a very cushy life? And all those kind of things. So many people would question that is there any value for studying and stuff? And similar questions and similar philosophy works if there is any role in disciplined life. Well, if you are searching for an example, then we will give you 4 very simple examples. Let's start. Sleep, exercise, regular food habit, and walking in the greens. So let's first start with the sleep. Sleep is such an important part of our life, often underestimated. Sleep is governed by a very tiny area in our brain, which comprises of only 20,000 cells in our brain, which is known as suprachiasmatic region. These controls the day and night cycle of our body, and these 20,000 cells beats a drum which is listened by 32 trillion cells of our whole body. When to wake up, how to control the metabolism, and all sorts of various other detailed things. In absence of adequate sleep, people can develop blood pressure, diabetes, and these even can give rise to cancers and those kind of other dreaded diseases. If it gets messed up, then everything gets hampered, from immunity to inflammation, and it can even give rise to cancers. There have been a lot of researches on workers who worked in London underground night shifts that we found out that blood pressure, diabetes, and cancers are even increasing in those patients. Hence, good quality and adequate sleep is so important. In 2017, there was a Nobel Prize which was awarded to the scientists who detailed about this function of these day and night cycle producing cells. Let's then go into exercises. If you have thought exercise is only to maintain your body weight, you are so wrong. And even I had that kind of idea. Exercise improves our mental health. That decreases the chance of cancer and dementia. How? If we get time, some other day, we'll explain to you. Apart from that, exercise gives rise to a better heart. And if you have got a better heart, you will have a better mentality. And if you have got the better mentality, you will be more prone to making right decisions in your life regarding your food and your lifestyles and everything, which again works against cancer. If you are doing adequate exercises, need for taking multiple medications will be reduced, and their side effects will also be reduced. Having food in regular times are very important. Often we skip breakfast, and which is a very grave decision at the first start of the day. We must have breakfast, and the breakfast has to be the heaviest meal of the day. Because with the breakfast, our body's metabolism starts and body starts to function. Walking in the greens are so important. Sometimes we think that walking in treadmill, or if we are doing a lot of household work, that will save us. Well, we have to change our decisions. That means if we are walking on the green, we are getting more sunlight, we are getting more oxygen and stuff, and all this trio makes the body super resistant to cancer. I have to say that our understanding about the cancer is still so premature, but still we knew about all these important parameters. So why don't you start with a good lifestyle to have a better life ahead? Even I am learning, so why can't you? So that's all today. Have a good day. We'll see you some other day over a new topic.